Hello everyone and welcome to Nursing to Do and to Be, your one-stop shop for everything nursing. This channel is committed to explaining healthcare processes, nursing diagnosis, medical interventions, diseases, illnesses, and what have you in layperson's terms, so you can have the right information to make clinical decisions as you encounter healthcare in your life's journey. So my commitment is to bring to you, levels that you'll be able to understand for explanations, especially relating to critical diagnosis and diseases. Last time we talked about stroke, and I promised to come back with an acronym to help you detect early signs of stroke, and here I am to give you just that. The acronym for stroke is, so detection of stroke is BEFAST, BEFAST. It means be fast, and as we all know, stroke is time sensitive. When you detect any of these symptoms that I will be elaborating on, it's critical that you act on it, because even if you go and they rule out stroke and it's negative, which means you don't have stroke, it's good, better than not seeking care at all. So listen to me and listen good. The acronym is BEFAST, be fast. The B is balance. All of a sudden, your balance is off. You can't get out of bed, you can't get out of chair, and even when you do, you're walking sideways, you can't seem to walk straight, and you are not that kind of person. You don't have any balance impairment to affect your movement. You have to think about stroke. And eyes is the next one, visual. For some reason, your vision is impaired. You can't see clear. We say you see double. So your vision is changed. Please follow up, because it could be a sign of stroke. The next critical element of the BEFAST acronym is face, F, facial expression. You look at your face in the mirror, one side is lower than the other. You smile like I'm smiling right now. You see how half of my face is similar or identical to the other, and you smile and your facial symmetry is not even. Please follow up. It could be a sign of stroke. And afterwards is arms. Okay, you can't keep your arm up, you can't hold your arms up, and you are not that kind of a person. You used to be able to do that. You cannot move your arm. Your arm movement is changed from your normal. Please pay attention to that. After the arm assessment is speech. Your speech is slurred. You're very eloquent, but you can't get words out for some reason. Or your words come out, but they don't sound the same. You feel like you're having difficulty to get the words out, or they're not expressing what you want to express. It's very critical that you pay attention to yourself. You do self-assessment, and if you identify any of these information that I'm sharing with you, you follow up with a healthcare provider. The last of the acronym is T, which simply means it's time sensitive. Stroke is very time sensitive. You have to act fast, because when you get there to the healthcare center, your timing is going to determine the path the healthcare providers will choose to treat you. There is a window of opportunity, and I don't want you to miss it. So note when you were last normal, when you were last doing everything normal before the onset of the abnormal characteristics that you observed. Make sure that if you can tell them, you tell them. If you can write it, let them know. Or if you call a family member to let them know and you go there, make sure the family member, they have access to the healthcare provider to be able to tell them that information, because that is very dependent on how, or the pathway they use to treat you. So I will say that you find yourself in a situation like that, please seek care. Even if you go and it turns out not to be a stroke, you haven't lost anything. You still have your life back. So please pay attention to yourself, and if you see any of these BEFAST acronym descriptions applying to you, seek care. Thank you for watching. God bless you.